What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. You're new here, welcome to you. Been here, watched the video, maybe even liked and subscribed. I appreciate you, and welcome back. So, today I want to discuss something that I've discussed a little bit, but not in depth. And one of my friends recently had a radical prostatectomy, and as we were talking about it, I was like, oh, I need to make sure that I bring that to the group. So the thing I want to talk about is that after you have your radical prostatectomy, there's a piece that's going to cause you some additional anxiety that if you don't know, it's going to be very difficult for you. So what's going to happen is that when the surgery is done, your surgeon is going to send your prostate out for pathology. And what that means is that they're actually going to send the whole prostate out. I don't know if they send it to the place where they had the biopsy or whatever, but they're basically sending it to see whether or not that what they said your cancer was in the biopsy is actually what your cancer is in your whole prostate once it's removed. So what happens is they did the biopsy, they came back and said, hey, your 3 + 4 = 7. So when they have your full prostate out, they send it back out, and they are looking at it to see the aggressiveness of the cancer. They're looking to see if you're still, what they find is 3 + 4 = 7, as they can check more of the prostate now to the side of your body. And so you have to wait. And your doctor tells you that, but not up front all the time. We're talking about the surgery and the catheter and all of those things, but they don't tell you about that additional piece of anxiety where they don't really give you all clear. And sometimes the doctor just says, hey, you're not all clear. Like, we can't fully say that you're cancer-free right now. And so they're looking and testing, as far as the margins is concerned, and making sure that the cancer was contained where they thought and said it was contained. You're going to have to wait. It's going to cause you some anxiety. You're going to be sitting there dealing with the surgery, trying to recover, the couple of weeks that you may have the catheter in, and then you're going to have to wait till your doctor and you go back to that visit for them to give you it all clear. My doctor gave me a piece of paper. That piece of paper, is important that you read it. They're going to go over it, of course, but it's important that you read it and you are prepared to ask questions. Am I still what they said I was before? It's one of the questions that you may want to ask. Additionally, did they say anything was different about the aggressiveness of the cancer? Did it show that it was aggressive? And then you need to make sure that you talk to them about the margins. How close in the margins did they get in regards to that? You want to make sure that you understand all of these questions and make sure that you ask those questions, because you want to make sure that you understand exactly where you are in the process. You do not want to be running around saying, I'm cancer-free, when in fact you are not cancer-free. Now, what does this all mean? If they find something different than what they found before, your treatment plan may change. You just need to be prepared for that. That you may have discussed, having a radical prostatectomy and then doing the next step, doing the step after that. And then all of a sudden, they're now telling you that you have to have radiation, or that there's another step that you have to have in there because whatever it is they thought initially wasn't. So just be prepared so that you are not stunned one way or another.